There's a reason doctors sometimes call it the silent disease, not because it makes no noise, but because modern life is already so loud that people often miss the signals completely. A little bloating, fatigue, stomach discomfort, feeling full too quickly. Symptoms so ordinary they disappear into everyday stress. And that's what makes ovarian cancer so dangerous globally. It rarely arrives like a dramatic movie scene. It arrives quietly. And by the time many patients realize something is seriously wrong, the disease may already be advanced. That uncomfortable reality has turned ovarian cancer awareness into one of the most important conversations in modern healthcare. Because unlike some cancers where routine screening is more established, early detection for ovarian cancer remains far more complicated. And timing changes everything. Around the world, healthcare systems continue struggling with a difficult truth. Many serious illnesses are easier to treat early, but harder to notice early. Which creates a brutal paradox. The disease that most needs early detection may provide the least obvious warning signs. And modern society accidentally makes this worse. People are busy, exhausted, distracted. Symptoms get normalized. Especially for women whose health concerns are sometimes dismissed, minimized, or delayed within healthcare systems globally. That's not only a medical issue. It's a systems issue. And systems problems become expensive very quickly. Because cancer treatment is not only emotionally difficult, it's financially massive. Hospitals, surgeries, chemotherapy, targeted therapies, long-term monitoring, recovery support, insurance negotiations. Entire industries now operate around modern cancer care. Which explains why global healthcare spending connected to cancer continues rising year after year. At the same time, researchers continue studying the causes and risk factors behind ovarian cancer symptoms and disease development. Genetics may play a role for some families, especially mutations connected to genes like BRCA1 and BRCA2. Age, reproductive history, and overall health patterns may also influence risk. But one of the most unsettling things about cancer is how unpredictable it can feel. Two people may live similarly. One develops disease. The other does not. Humans prefer simple explanations. Biology rarely cooperates. Meanwhile, the internet floods people with miracle cures, detox myths, and misleading health advice promising impossible results. Because fear attracts attention. And attention became one of the internet's most profitable currencies. A serious disease appears online, and suddenly random influencers with zero medical training speak with the confidence of research scientists. Modern civilization made information available instantly. Unfortunately, accuracy did not always arrive at the same speed. Meanwhile, real medical science moves slower, quieter, and more carefully. Researchers analyze patterns across years, not viral trends across weekends. Treatments improve gradually through testing, data collection, and long-term study. Which is less exciting for social media algorithms, but much safer for actual humans. And this is where the global healthcare story becomes fascinating. Because advances in cancer research over recent decades genuinely changed survival outcomes for many patients. Surgical techniques improved. Chemotherapy strategies evolved. Targeted medicines became more sophisticated. Genetic testing expanded. Precision medicine started reshaping treatment decisions. Modern medicine became increasingly personalized. Not perfect, but smarter. Still, access remains deeply unequal worldwide. In wealthier countries, patients may receive advanced diagnostics earlier. In lower resource regions, delayed diagnosis and limited treatment access remain major problems. Again, geography quietly influences survival odds. The science may be global. Healthcare access rarely is. And here's the irony most people never think about. Humanity created technologies capable of mapping the human genome, while millions still struggle accessing basic preventive healthcare. That contradiction sits at the center of many modern medical systems. Technology races forward.
The most difficult thing about ovarian cancer treatment is not always the treatment itself. It's uncertainty. Because uncertainty changes how people think, plan, work, and live. A patient may wait for scan results. Families wait for updates. Doctors analyze progression carefully. And behind every decision sits complicated medical math most people never see. What stage is the disease? Has it spread? Will surgery help? How aggressive should treatment become? Modern oncology is not guesswork. It's constant probability management. And probability becomes emotionally exhausting when human lives are involved. Meanwhile, global pharmaceutical industries continue investing billions into targeted cancer therapy and immunotherapy research. Scientists increasingly focus on treatments designed to attack cancer cells more precisely while reducing damage to healthy tissue. That shift matters. Because older treatment approaches often affected the entire body aggressively. Modern medicine increasingly tries to become more accurate instead of simply more powerful. Which sounds logical now. But achieving precision inside the human body is extraordinarily complex. Cancer cells evolve, adapt, resist treatment. The disease behaves less like a fixed enemy and more like a constantly changing system. And systems are difficult to control permanently. That's one reason cancer research continues consuming enormous global resources financially and scientifically. At the same time, there's another hidden layer most people rarely discuss openly. The economic burden on families. Even in countries with advanced healthcare systems, long-term illness can disrupt careers, savings, education plans, and emotional stability. In regions with limited healthcare protection, the pressure may become even more severe. This is where disease becomes larger than medicine. It affects entire households, sometimes entire generations financially. And that reality forces uncomfortable political questions. Should healthcare operate mainly as a business? A public service? A mixture of both? Different countries answer differently. None solve everything perfectly. Meanwhile, social media continues creating strange contradictions around health discussions. Awareness spreads faster than ever before. Support communities connect globally. Educational information became more accessible. But misinformation spreads just as rapidly. One misleading video can reach millions before medical experts even respond. And emotionally persuasive false hope often travels faster online than careful scientific truth. That may be one of the defining challenges of modern healthcare communication. Not only discovering treatments, but protecting public understanding itself. Still, despite the complexity, progress continues quietly. Researchers improve diagnostic tools. Doctors refine treatment strategies. Survival outcomes improve in many cases compared to previous decades. And patients worldwide continue benefiting from advances that would have sounded impossible generations ago. Yet one uncomfortable question remains underneath all of this. Why do so many healthcare systems still focus more heavily on treatment after disease appears, instead of prevention and earlier detection before the damage becomes severe? Because prevention rarely creates dramatic headlines. But prevention changes lives long before emergencies happen. And perhaps that's the broader lesson hidden inside the global rise of women's health awareness and ovarian cancer discussions. Modern civilization became incredibly advanced at responding to crisis, but still struggles building systems that consistently prioritize early care, equal access, and long-term prevention at scale. The science exists. The knowledge exists. The technology keeps improving. The harder question may be whether societies are willing to organize healthcare systems around prevention before profit, awareness before panic, and long-term public health before short-term attention cycles. Because the future of cancer care may not depend only on discovering better treatment.